So the labs. So a lot of folks, of course, have been burned, if I may say, by getting evaluations when they go and see a weight loss clinic. A lot of um, respectful endocrinologists in the past used to order like a ton of labs for any case that is being treated or evaluated for weight loss. We do know that we learned a lot from those patterns. But nowadays, and specifically in my clinic, we try to do not the bare minimum, but the most important labs, and that also is ordered in your first visit. Um, to briefly summarize those labs, also let me say we definitely order your blood counts, liver and kidney functions. We definitely order the electrolytes. Is called the basic metabolic panel. Not that it is a metabolic measurement, quote unquote. Definitely, we look very closely at your cholesterol, your sugar levels. The sugar now is becoming a big player, especially in this pre-diabetes era that we're trying to tackle diabetes and pre-diabetes early. Um, I do order thyroid. I do also in certain cases, and I learned um very well which ones are going to need it. Some cases need what we call the thyroid antibodies, a little bit of a more detailed. I don't necessarily order the insulin level anymore. I think it's a very good test, but it doesn't help me much. I do order other indicators of inflammation and cardiac risk, and specifically CRP, specifically uric acid. I still believe that will be a helpful tool or indicator, long term, short term, but we don't obviously sit down and microscopically dissect any of those labs. Uh, what else? Let me see. So, vitamin D, I used to order a lot. I love it, but it's an expensive medicine. So, many a time I just skip and go directly to the supplementation and advise patients to take vitamin D. Vitamin B12, I order that lab to see the levels in specific cases also that I think might benefit from B12 supplementation. So, bottom line, the labs are basic, they are helpful. When I have recent labs that were done by any other doctor, like your primary care, like your gynecologist on these matters, we definitely don't sit down and repeat them and do any fancy labs. So we usually get the results after the first visit and contact the patient on those labs before the second visit, especially if we're going to do any treatments or any changes or any additional what we call uh, interventions, maybe for example, if I see somebody's sugars are out of range, I might start metformin or early. If somebody's cholesterol is out, I will be or up, I will definitely try to be very patient because I know those indicators improve after weight loss. Then the last thing, when do I repeat labs? Patient ask me. I definitely don't also want to repeat labs because it's a moving target. I don't want to repeat them every 6 months or every year. We definitely want to see how your labs improve, maybe in certain cases that we have specific targets. But other than that, it should be easy, and these labs should be very informative to you and me.